Thank you, Mr. Chair. I appreciate that. Interesting that you use the word conspiracy. That's not ever been a word or a challenge that we've made to this process. But it does occur to me that there was an effort to hide information. And that's what troubles me as much as anything else does in this process. That we knew for 4 years that we were not verifying incomes of people on Medicaid, and yet we chose to hide that instead of tell people that that's what was happening. We potentially risk $100 million clawback per year for each year that we were not verifying information for these families. Where I think our levels of income are pretty draconian on who we do and who we don't cover, it is what it is. And I do not sit here wanting anyone else to qualify for Medicaid in our state than currently qualify it, other than the potential of an expansion, which we will wait until November to see what happens. We verified custodial parents, and we found out they didn't qualify. We had to have known at the same time, with very little effort, that their children still did qualify. Yet it was our state's default position to kick the entire family off from health care. The information we have from a legal aid service in the St. Louis area is that all but one of the children that they actively sought to put back on health care requalified. The one did change custodial parents and was not qualified at that time. So that was a 300-to-1 process of children that they got back on, and these were people who knew enough to go into a legal aid service to be able to have some help. We know our applications are troublesome. We know the notifications are confusing. We know the regional offices aren't the same help that they used to be. And yet we take our most at-risk populations, the most transient populations, and we mail them applications. We put our services online, and many of these people don't have access to the internet or broadband in so much of our state. These are people who have poor support structures, may not have access to transportation, may work a job that doesn't accommodate a 45-minute hold time. And then we tell the parents they need to put their children back onto health care. And we blame the parents for not doing that. If we cared about providing services, we might have healthy families able to take advantage of the job opportunities, the workforce development that we're trying to move towards in the state. After the meeting we had a couple of weeks ago, and we heard that there was 6 weeks that people were notified that their children were coming up and they might lose coverage, and we sent them everything we could, and we texted them and we robocalled them. We tried every way that we could to contact them. I had a friend of mine call me last Thursday. Her daughter, she got a phone call on Thursday, the last Thursday of January, and was told her daughter would be kicked off of health care the following day. Her daughter is severely disabled, gets a waiver that regardless of her parents' income, she will always have access to Medicaid. But Julie, on Thursday afternoon, was told her daughter would be removed from health care the following day. When she called the one person whose phone number she was left with, the person said, well, I'm sorry, your daughter was actually taken off from health care on January 1st, and I can't help you in any other way. I don't know what else to do for you. So Julie started calling around and found out that because her daughter had gone from 18 to 19 might have been the hiccup on why her daughter was removed from health care. And Julie indeed had the paperwork that she needed to for legal guardianship and could fax it to somebody, but it would still take 2 or 3 days for them to be able to move through the paperwork and get her daughter back on. At one point, Julie called the call center, and they said, gee, I'm so sorry, the wait times are so long that we advise you to call back tomorrow morning between 7:30 and 8, and the phone line hung up on her. So we talk about call times. We don't necessarily talk about the retention or the deflection or how many lines they have. Julie was told to call back the next morning at between 7:30 and 8. So our call time centers don't seem to have the performance that we're being told that they have in here. I've heard of another story that an individual was unemployed, but her letter said she was rejected because she had an increase of her income. She was still not able to get through to the 800 number. We send out all of the letters at the same time telling these families that they're about ready to have their children dropped off from health care, and then the call centers are overloaded, and we wonder why that's happening. I don't understand as a state why we have ripped out the rug from underneath these families and say your children no longer qualify, and yet then we want the family to be able to get themselves back on. Why are we as a state not auditing what we've already done? Why are we not, as a state, auditing the 30,000 custodial parents that we've removed to see if they don't have children that still qualify? And why are we not either automatically putting them back on or knocking on their door to find out if indeed their children still qualify? We've made that error. I live towards correcting my mistakes when I find that I've done them. Why are we as a state not pursuing these 30,000 custodial parents whose children have been removed? Why are we not going through that process of getting them back on the ballot? I think this is incredibly troubling for us as a state. We brought up these issues the last year. We've talked about these children that have been removed from health care for a year's worth of time, and yet we've wanted to play politics with it over the summer. I appreciate we may not have known what was wrong, but I also appreciate we had a committee hearing in this building the day after veto session where we had families come and tell us what was happening. So why we don't want to be part of knowing what's going on has ventured into nothing but the political arena of this, and I'm sorry that that's happened. I am most concerned, certainly, about the children and the lack of health care that we have in this state. I have recently heard from a physician who has practiced in states where we provide better health care for our children, and he says Missouri's not one of them. I am then also significantly concerned about the effort that was made to hide this information. It concerns me tremendously of what's still being hidden from us. I understand there was a conversation earlier today about fund balances in Washington, D.C. that have Missouri's name on it. And I can't tell you how much I'm concerned about what's being hidden from us, how our questions are not answered when we ask them from a budget point of view, how when we tell departments to spend money, there's a, oh, gee, by the way, we didn't think we needed to do what you told us to do last year. I'm just slightly appalled at how we, the electeds, are not able to appropriate monies through the process with a budget chair here, an appropriation chair in the Senate, and the governor with all of us passing these bills, directing how money is spent, and there are hundreds of millions of dollars. You want to talk about being fiscally conservative, then we need to look and see why there are hundreds of millions of dollars sitting around this building and now apparently in Washington, D.C. There's our taxpayer dollars, and we're not funding health care for children. Thank you, Mr. Chair.
All right.